every province is different. You've seen how different the Atlantic to the territories to BC to Alberta, but all 6 provinces that are sort of west of the Atlantic are either experiencing or it's likely to experience a resurgence in the coming days and weeks. So, and some big provinces, Ontario, are taking a more regional approach. So there is definitely merit in that, but of course people do travel in between. So that has to be borne in mind. In areas where you have variants, where you have been doing this up and down sort of measure, I think it is a really important approach, perhaps to not go up and down too much, but sustain a certain level of restrictive measures. It may not be stay at home for every area. It's more you've got to implement measures that work in your community where people are going to stick to as few interactions, as few times, shortest amount of time with the variants escalating. So if there are detections that this activity is ramping up, then definitely don't relax and try and keep that even keel until the vaccines have gained much more of acceleration in terms of coverage. And so, with the approach that Canada is taking overall, just trying to get that first dose into as many people as fast as possible. And with the doses now we're getting, it's possible to get that vaccine offered to everyone before the end of June. So with that in mind, you can think about that kind of time frame and maybe trying to keep a steady state where you're not going to suddenly get these resurgences until that kind of time frame where most people would have at least got 1 dose.